Hello, I will be talking about leadership in healthcare management, a strategic approach. First, I want to walk you through the structure of this presentation so you know what to expect. I will first identify the specific healthcare issue that it needs attention. This could be anything from staff burnouts, which is a crucial issue affecting many healthcare environments, to communication breakdowns, or even patient safety concerns. Second, I will introduce the leadership model. I propose and explain how it directly addresses the issue. For example, I will discuss transformational leadership and how it helps leaders inspire, motivate staff to improve their performance and well-being. Third, I will share a strategy for engaging key stakeholders, both at the leadership and staff levels, to ensure that they buy into the proposed model. Gaining stakeholder buy-in is essential for successful implementation. Fourth, I will outline how we will evaluate the effectiveness of the model. We need to track its success through various metrics and feedback loops to make sure it's having the desired impact. And finally, I will discuss the expected impacts of the model. This includes improvements in the quality of care, staffing performances, financial outcomes, and overall organizational cultures. As you can see below in my flowchart, these steps are structured in the logical progressions, which will help us move from identifying the problem to implementing the leadership model and ultimately measuring its impact. So in summary, by the end of this presentation, you have a clear understanding of how we can use an effective leadership model to address our current healthcare challenges, how we plan to involve key stakeholders in the process, and how we evaluate and measure success. Now, let's turn our attention to the specific issue I will be addressing today: staff burnouts in healthcare settings. Healthcare issues, staff burnouts, is a significant and growing issue with healthcare organizations. It is caused by prolonged stress, heavy workloads, and emotional strain, leading to physical, emotional, and mental exhaustion. Burnouts is particularly common among healthcare workers like nurses, doctors, support staff who face intense high-pressure environments, often without adequate rest or support. Impact on healthcare organizations. The impact of burnouts on healthcare organizations is profound and multifaceted. First and foremost, burnout leads to reduced staff performance. Workers who are burned out are more likely to make mistakes, leading to medical errors, lapse in patient safety, and general decline in the quality of care provided to patients. This not only harms the patients, but also diminishes the overall effectiveness of the healthcare team. Secondly, burnouts result in a higher turnover rate. Healthcare workers experiencing burnouts are more likely to leave the profession, which only adds to the organization's challenges. High turnover rates cause a constant strain on resources. The cost of recruiting, hiring, and training new employees are significant, and the loss of experienced staff can lead to gaps in patient care. Finally, the cumulative effect of burnouts is often a vicious cycle. As more employees leave or take time off due to burnouts, those who remain face higher workloads, which further accelerates burnout among them. This results in further staff shortages, additional pressure, and more burnouts, making it harder to break the cycle. Statistics with the scope of the problem will give you a clear picture of the scale that problem considers the statistics. So according to 2021 study by Darby and colleagues, 60% of healthcare workers report experiencing burnouts. This is an alarming number that highlights just how widespread burnouts is across the healthcare organization. When you think about 60% of our healthcare workforce is suffering from conditions that not only affect our own well-being, but also compromises the patient care and organizational performance. So given the widespread and damaging effects of burnouts, addressing this issue is essential for improving the health of our workforce and the quality care provided to those patients. Now let's explore a leadership model that can help mitigate these issues. So on this slide, I want to speak about how leadership styles focus on inspiring and motivating employees to exceed expectations and aligning with the organization. Next, it's idealized influencing, inspirational motivation, intellectual stimulation, and individualized consideration. Now, as I'm moving on in the leadership model, I do recommend addressing the issues of the staff burnout, the transformational leadership. Transformational leadership is a leadership style that emphasizes inspiring and motivating employees to exceed their expectations and achieving goals that align with the organization's broader vision. Unlike transactional leaderships, which focuses on rewards and punishments, transformational leadership seeks to elevate both individual and organizational performances by fostering a positive, motivating environment. As the name suggests, transformational leaders, they aim to transform their organization and their employees, not just by focusing on day-to-day tasks, but by creating a culture of growth, motivation, and trust. The goal is to inspire the staff to take ownership of their work, push beyond their limits, and align with the mission, vision, and values of the organization. This approach is particularly important in healthcare, whereas emotional and physical demands on the staff are high. Transformational leadership is built upon 4 core elements, each of which plays a crucial role in motivating employees and addressing burnouts. Let's go over these one by one. Number 1, idolized influence. This refers to the leader's ability to serve as a role model. Transformational leaders act with integrity, set high ethical standards, and demonstrate behaviors that employees want to become as well. This builds trust and respect, with each essential, which is very essential in reducing burnouts by fostering a positive, supported workplace culture. Number 2, inspirational motivation. Transformational leaders inspire their team by providing a clear vision and fostering optimism. By communicating a compelling vision of the future, they motivate their staff to commit to organizational goals. This can help reduce burnouts by reminding employees of the importance of their work, why they're there for the patients and the safety, and how to contribute to the larger mission. Intellectual stimulation. Number 3. This element involves encouraging creativity and problem solving. Transformational leaders challenge their employees to think critically, explore new ways of working, and continuously improving. This can be particularly valuable in the healthcare, where challenges are often complex and require innovative solutions. It helps employees feel valued for their contributions and counteract feelings of frustration or stagnation that contribute to burnouts. The fourth one is individualizing consideration. A transformational leader provides individualized attention and mentorship to the employees, recognizing their unique needs and fostering professional development. This personalized support can help alleviate stress and burnouts by showing those employees that they are cared for and truly valued. When employees feel understood and supported, they are more likely to remain motivated and engaged to their environment of their workplace. In essence, transformational leadership is about creating an environment where employees feel inspired, valued, and empowered to perform at their best. By applying these core elements, idolized influence, inspirational motivation, intellectual stimulation, and individualized consideration, we can address the issues of burnouts by improving staff engagement and ultimately enhancing the quality care providing in healthcare settings. The principles behind the leadership model enhances the vision of the verbiage that ties in theoretical foundations. Theoretical foundations. Number 1, the Maslow Law hierarchy of needs. The transformational leadership aligns with the Maslow theory by addressing the full spectrum of human needs. The leaders first ensure that the basic needs, such as a job, security, and appreciation, are met. Then they inspire followers to reach higher order needs, such as self-actualization, promoting growth, and creativity. That's from Bass, 1999. The Heisenberg two-factor theory. Motivation is driven by the presence of both hygiene factors and motivators. The leaders enhance their job satisfaction by improving hygiene factors like working conditions and salary. At that same time, they inspire employees through motivators, including recognitions, career advancement, and opportunities for personal development, leading to higher engagement and performances. Below, I have some steps for implementation and strategies for adopting the leadership model. I want to begin by providing comprehensive leadership training to senior management and team leads to ensure that they understand that they can effectively apply the leadership model. This training should focus on the core principles, strategies, and skills necessary for success. Number 1, communication plan. I want to actually help them develop a clear communication strategy to inform all the employees about the leadership model's benefits and goals. The communication should be emphasized how the model will positively impact both individual growth and the organizational growth. Next, the pilot program. I think it is crucial to implement this leadership model within the selected departments or a team as a pilot program. This phase will allow for testing and assessment of the models, effectiveness, and enabling necessary adjustments before rolling it out across the whole enterprise and organization. Next, the timeline for adoption. So if we were to timeline this, the pilot phase would be 3 months to assess and refine the model. The full adoption, I would say, would take 6 months for a broader implementation across the organization. And I would also offer an ongoing evaluation and adjustments. By doing this, it's continuous monitoring and refinement to ensuring that the model remains effective and relevant. Next, I want to identify key stakeholders. Executive leaderships, the CEO, the CFO, and the board of directors must ensure that the leadership model aligns with the organization's strategic goal. Their leadership and commitment will be key to driving this initiative forward and securing organizational support. The department heads and managers, those leaders will be crucial in cascading the model throughout their teams. They'll be responsible for ensuring effective communication and implementation, guiding staff through the transitions. Now, as far as the healthcare staff, the nurses, the physicians, and the support staff are the direct beneficiaries of the leadership model. By focusing on improved leadership, the practice, we aim to reduce the burnouts and improve overall job satisfaction by leading to a better patient care and more engaged workforce. Now, some strategies for obtaining a buy-in are executive leadership, healthcare staff, and incentives. So first, let's talk about executive leadership. To secure support from our executive team, we'll demonstrate how this leadership model directly aligns with our strategic goals. By focusing on reducing burnouts and improving patient outcomes, we can show how this model contributes to broader missions of the organization. Second, healthcare staff. For healthcare staff, we need to present compelling evidence that this leadership model will actually reduce burnouts and improve job satisfaction. By highlighting how it creates a better work environment, we can show that something that will make a real difference in their day-to-day lives. Lastly, incentives. Who doesn't like incentives? We want to make sure we offer incentives to encourage engagements, such as professional development, opportunities, recognition, and the chance for career advancement. These tangible benefits will motivate all of the staff to actively participate and embrace the model. Now, for my evaluation plan, I want to make sure to talk about the employee satisfaction, patient outcomes, operational efficiency, and continuous feedback. So let's start with employee satisfaction. To elevate the impact on employee satisfaction, we use surveys like Maslow Burnout Inventory to track changes in the burnout levels. This will help us measure how effectively the leadership model is reducing stress and improving the well-being of our staff. Patient outcomes. We'll also monitor the patient outcomes, focusing on metrics such as patient satisfaction surveys and safety. These indicators will show how to improve leadership and how they can positively affect patient care and overall hospital performances. Next, operational efficiency. In terms of operational efficiency, we'll measure reductions in turnover rates and improvements in team performances. Lower turnovers and higher team performances are strong signs that the model is fostering a more supportive and effective work environment. And lastly, continuous feedback. Well-established a system continuous feedback through a regular survey, focus groups, and performance reviews. This ongoing feedback loop will allow us to make necessary adjustments and ensure the model remains effective. On this next slide, I want to make sure to help on giving the information on impact on quality performance, finances, and change management. Here is a slide that shows 4 different arrows, and I want to make sure to identify the planting, the monitoring, the reviewing, and rewarding. Here is how you can present the content effectively. Impacts on quality care and performance, finances, and change of management. With a higher staff engagement and improved leadership, we can expect the reductions in errors and better adherence to clinical protocols. This ultimately leads to enhanced patient safety and quality of care. The performance. As a team, we can become more cohesive and motivated. We'll see improvements in the overall productivity. This results in better clinical outcomes as staff are more focused and collaborative. So you want to make sure that you're understanding the cycles of SMART goals and SMART metrics. The performance management cycle is a continuous process that involves setting expectations, monitoring the progress, providing feedback, and evaluating those results. It does ensure that employees are aligned with the organizational objectives and are continuously improving their performance. So when we integrate the SMART goals framework into the cycle, we make performance expectations clear and more achievable. SMART stands for specific, measurable, achievable, relevant, and time. So specific, those goals should be clear and well defined. For example, improving a team communication by holding weekly briefings to discuss patient care. I think it is crucial that you meet together with your team and have huddles to making sure that we're all on the same page. Measurable, those goals need to have measurable criteria to track the progress. This could be measured by tracking the numbers of success for patient handoffs between shifts. So making sure that we understand that there is that goal there, that it could be measured. Achievable. Goals should be realistic and attainable based on the available resources. Providing training on new systems or items or protocols that team members can realistically apply in their daily work. It is very crucial that they are realistic and attainable goals, or the staff might not want to accomplish them. Relevant. Those goals should be aligned with the broader objectives of the organization and enterprise. For example, reducing patient wait times, when directly ties into the hospital's strategic goals of improving patient satisfaction. Time. The time-bound goals should have a clear deadline or timeline for completion. For instances, improving team responses times within the next quarter. Without having those times, it's not going to be attainable because we have to have a completion for them to work forward for that quarter to come. So by incorporating these SMART goals into the performance management cycle, we create a structured and measurable way that can track those improved performances. It does improve clarity, accountability, and motivation for those teams, ensuring that their efforts are directly contributed to the organization's success. So when we talk about the finance perspective, those leadership models will help reduce those turnover burnouts, which are costly issues. And by increasing those employee retentions, we can achieve long-term savings while fostering more stable and effective workforce. We want to make sure we have a change of management. So if we embed a culture of ongoing learning and improvement, this model enhances the organization's adaptability. Staff will be better equipped to embrace changes and fostering more resilient, forward-thinking organization. In my last slide, for conclusions of the transformational leadership model, I have aimed to create a culture of growth, engagement, and well-being benefiting both healthcare staffs and patients. By addressing issues like burnouts and improving job satisfaction, while aligning leadership with the organizational goals, we are paving the way for long-term success. Through clear steps such as training, communication, and continuous feedback, we ensure that the leadership model is in line with both organizational objectives and those individual needs. The impact of the model that I spoke about will be measured using key metrics such as employee satisfaction, patient outcomes, operational efficiencies, and allowing us to track progress and make necessary adjustments. This is not just a short-term solution, it is an investment in the long-term quality of care, performance, and financial stability of the organization. By reducing the turnovers, improving team performances, and fostering adaptability, we are building a more resilient and effective workforce. Now, it's time to embrace this leadership model and take actions to create a supportive, positive environment that drives meaningful change to our staff and to our patients. Thank you so much. On my last slide, I do have my references that I use throughout my presentation as well. Thank you.